And indeed there are a few studies that, it's a little bit mixed, but there are a couple of studies that do show that. First of all, in kids, there's a couple of studies, Dina Hirschfeld's group at Boston have looked at kids who score high on behavioural inhibition. So these are categorically the top 15% of scorers on this sort of fearful temperament type of behavioural inhibition, and yet a large number of those do not meet criteria for disorder. And the first one of those, these were kids aged between 4 and 7, scored in the high group on behavioural inhibition, and only a third of those kids met criteria for an anxiety disorder. In the second study, Dina's study, the only way I could actually identify kids who had concurrent measurement of temperament and disorder was that this was a subgroup of kids who had been consistently indicating behavioural inhibition across several different time frames. So they, I think, looked at four times across childhood, and these kids came up consistently inhibited at each time. So they're a very extreme group of inhibited kids. And even in that extreme group of inhibited kids, only 2/3 of those kids met criteria for an anxiety disorder. So even selecting the most extremely inhibited kids who are consistently inhibited across right through from infancy through to middle childhood, you're still getting about 2/3 with an anxiety disorder, a third who don't meet criteria. We then did a couple of studies where we had slightly different results, and in our studies we looked at kids who score high on parent-rated shyness and also laboratory observation of behavioural inhibition. And in both those groups we found the majority of our kids did meet criteria for an anxiety disorder. I guess the limitation is that we are running, and in both those studies that we were running an intervention, and so we found quite a number of parents who didn't actually come along to the intervention. So it's possible then that the ones without disorder were the ones who didn't actually turn up for the intervention. So maybe we've got a biased sample, but our results are a little different. Some, to me, more interesting results come from some adult research, and this is a little bit different. But one of the interesting questions is if you can identify people who are discordant for the two, that is people who score high on temperament but don't have disorder, what is it that discriminates? What is it about those people that makes them either have disorder or not have disorder? There's a study done, I don't know how you say that, Heiser and colleagues, Sam Turner and Debbie Beidle's group, and they looked at socially phobic and socially anxious people in a couple of different studies. And what they did was they selected a group high on shyness and compared them to a group of people who presented clinically with anxiety, with social phobia. And what they found was the socially phobic people were categorised or characterised by having more overt avoidance type behaviours, by having poorer social performance, and in general, because of those things, having greater life interference. So they showed very similar sorts of behaviours in general, both social concerns, worries about other people, what other people thought, etc. But the socially phobic people avoided more, and as a result of that greater avoidance, tended to perform worse and have more interference. A better study was done by Denise Shavira, Murray Steen and their group, where what they did was they selected the people on the upper decile of shyness, so the top 10% of a measure of shyness, and then they diagnosed those people with a structured interview, and they found that only about 50% of those met criteria for social phobia. So that's a nice bit of evidence about the discordance. They also found that out of the group of non-high shy people, there was about 18% met criteria for social phobia. So they also found the flip side. You can have people with social phobia who did not score high on shyness. And broadly what they found, the difference was that the people with social phobia reported greater life interference. Again, very similar symptoms in general, but the symptoms are more interfering and more impairing and more problematic for the people with social phobia. Slightly different focus, but I included these anyway because I just thought it was a very similar conclusion. This is some research done by Ruscio and Tom Borkovic and their group, looking at people with high levels of worry, which is not really a temperament type, but I'm sure it's very strongly related to negative affectivity and temperament style. And they looked at several studies where, again, what they do is they get people high on worry and then diagnose them, and they find that around about half meet criteria for generalised anxiety disorder, and the others don't. And again, when you look at the difference between them, what you consistently tend to find is those with the diagnosis report greater life interference, greater distress, and together with that, less control over their worry, leading to the greater distress and interference. In one of their studies, they had a very recent study, they had diary reports. So they got people with who are high on worry, some of whom had generalised anxiety disorder, some of whom didn't, to keep diaries, daily diaries of their worries. And they found the difference between the two, you couldn't pick between the two based on the actual worries themselves. Both had equal numbers of worries, equal severity, equal content, topics of worry, everything was the same about the worry, but the differences were that the people who with generalised anxiety disorder reported that they experienced that their worries were less controllable, and as a result of that were far more interfering and impactful on their lives than the people without generalised anxiety disorder. Right, hypothesis 3, you would expect, based on the sort of traditional models of temperament, traditional models of disorder, you should find that temperament is more stable than disorder. And in general, the answer is this one doesn't discriminate. This would suggest that the two constructs are not that different, and it's because measures of temperament are incredibly unstable, well, compared to what you would expect from the construct. So in general, a bunch of different studies, Anne Sanson's group in Australia have shown correlations across time stability, across time of around 0.6, 0.7. Another study looking at BI, looking at similar, about 0.6 across periods of sort of 3 to 4 years on measures of temperament. I put in Jerry Kagan's one because to me that's the most demonstrable. That's one of the nicest studies. That people always think about BI, that the way that Jerry Kagan talked about it, as being the sort of stable construct. You know, once these kids are BI, they're always going to be BI. And if you look at his 2 times, only 25% of his kids were BI between 2 and 7.5 years of age. So the vast majority of kids don't continue to stay in that BI category. And then Margot Pryor's group, the Australian Temperament Project, also looked at shyness as a categorical measure, high shyness across time, across several years, and found that only about just over half the group actually reported or actually showed being shy on more than one occasion. And if you looked at how many of the kids actually reported being shy right across their childhood at all 8 points, it was virtually none, less than 1%. From the flip side, when you look at anxiety disorders, you tend to find that anxiety disorders are among the most stable disorders of all, and in particular social phobia. Once again, that link with social phobia is a particularly stable disorder, and this is data from the Harvard longitudinal study that over 5 years, only 30% of people with social phobia, these are adults now, adults with social phobia lost their diagnosis over a period of 5 years. On the other hand, panic disorder is a far less stable disorder and does tend to remit with time. I won't worry about this particular one. This is the same sort of thing, looking at anxiety symptoms, showing that the stability correlates for anxiety symptoms, when measured on a questionnaire symptom basis, the stability correlates are pretty similar to the correlates for temperament. So at least based on stability, we can't really differentiate anxiety disorder and temperament. Hypothesis 4 would be that you should expect that a greater proportion of the variance in fearful temperament should be accounted for by genetic factors. The general sort of assumption is that when we're looking at temperament, we're looking at something that's more sort of fundamental, if you like, more sort of genetic, and an anxiety disorder less so. Therefore, you should find, say in twin studies, that a greater proportion of the variance is accounted for by genes in temperament. When you look at anxiety disorders, the sort of the general assumption, or the general sort of figures that people talk about across several reviews in both adults and kids, is about between 30 to 50% of the variance in anxious symptoms is accounted for by genetic factors. You get little difference between the disorders, except perhaps for separation anxiety, which is a little bit, it seems to have a little bit less of a genetic involvement. When you look at fearful temperament, studies of BI are very small, and I would worry about the reliability of these, but nevertheless the studies of BI generally indicate about 50 to 70% of the variance accounted for by genetic factors, which, you know, we don't have great reliability across the two, but it's higher than the 30 to 50% perhaps.